Hello, everybody. Welcome. I am pumped. That's the perfect word for it. I'm pumped to be here with Megan Pomarensky. Megan and I met last year through my husband, Brendan, and she's collaborated with Brendan and Kevin Carr through Movement is Medicine. They've been friends for a long time. I was fortunate enough to be introduced, and I can't say enough about how much I've enjoyed learning from Megan because now, Megan, I follow you on social media, but we've also now worked together and you participated in the speakers league that I just concluded. And how that leads to us sitting here today is Megan, during the speakers league, she was developing a presentation to bring together all of the research that she's done on the biopsychosocial model. And it was fascinating. So much so that often on our one-on-one calls, we would get off in conversations about communication and just the experiences that people have with us in whether you're a therapist or maybe a coach. And we decided it would be best to have that conversation live so that other people can hear it and not only learn from one another, but see where we can take this. So Megan, with that, I'm going to let you tell everybody what you do and a little bit about your work, and then we can go ahead and start the conversation.
Thank you so much for that amazing introduction. I've had such a blast learning from you as well in our conversations. And I'm very grateful that Brendan randomly shared, I shouldn't say randomly, he didn't randomly share what you do, but he did. And I happened to see
Share
it at the
this.
right time. Yeah, I happened to see it at the right time almost exactly a year ago. I think it was in June, not the first presentation I really formally did. You helped coach me through and build that out. And it really, learning from you and the communication skills really put the bow on the package of athletic therapy and training for me, and how to really put things together in a way that my clients would better understand. Which I work full time in private practice. I have for 8 years. I own my own business called Empowerment Rehab and Training. And based on the name of that, my goal is always to empower my clients to get the tools that they need to succeed and to find it within themselves. And I realized that the only way they can find it within themselves is if I can communicate better to them how to pull that out. So tying that back in with my master's research on why some people just don't get better with chronic pain, I realized that everything comes back to language and why words matter so much. So that's a big part of why I think you and I get along so well.
Yeah, absolutely. And what I've really enjoyed is you've been able to put what I teach into the context and make it so much more specific to how you're going to apply it, whether you're in a clinic or a gym. And that's what you and I decided we were going to talk about today, was understanding maybe how you feel about yourself as a professional and just personally, and appreciating that how you show up to people impacts your ability to help them. And you can have all of the education and the skills and whatnot, but if you're not also thinking about how, like you said, the words you're using, the way you're physically showing up, what information you decide to share and what information you decide not to share or wait to share, that's all impacting how much people trust you. It's impacting how much they want to share with you. And that brings us to the first little discussion topic we decided on, which was you were taking me through your presentation on the biopsychosocial model, and we started talking about how, well, you see some therapists and I see coaches sometimes hesitating to articulate or share either what's going on with their client or their athlete, or what they want to get out of the treatment process or what their plan is. They're not either communicating it directly or they're communicating it in a way that feels really convoluted. So I want to talk a little bit about that. And I'm curious from your perspective, what you've seen in other therapists, what you see in your own practice and maybe in yourself, is what do you think are some of the reasons why we see therapists and coaches hesitating to know what to share, when to share, or how to share it?
I love this question and topic because I think there's a few different categories of why people are so nervous and apprehensive about it. And the first is that coaches and therapists seem to be afraid or nervous that something is going to go wrong and they're not going to be able to live up to what they say. And they're putting something out there and making a promise. They feel like they're making a promise that's set in stone to this client, as opposed to proposing a treatment guideline or a treatment plan and understanding that plans can change, that then they get scared to overcommit and underdeliver.
Where do you, when you were describing that, what came to mind for me is this idea that seeing as you're in a specialized field, do you think there's an expectation of, if I came to you, let's say for treatment, do you think I, as your client or patient, or whatever you would refer to me as, would I have an expectation that you would have a boom, 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 this is what we're going to do, give it to me? Like, who's creating the pressure for the athletic therapist or a coach to feel like they have to be able to give a certain plan and they can't veer from that plan?
I think it's both, to be honest. I think clients typically are coming to us because we're considered an expert, whether they found us randomly through a Google search or somebody referred them. They're coming to us because they believe we have the answer, when really the client always has the own answer to their problem themselves. But they come to us thinking we're going to fix them because there's something wrong with them, and that we, as the therapist or the coach, have all the tools and we're going to tell them what to do and they're going to fix it and things are going to be perfect. So that's one side of it. Then I do think the other side of it is still coming from the coach or the therapist, where we're often trying to prove how smart we are and think that there's all this pressure that we just put on ourselves, when if we think about a knowledge scale, our clients are most likely at a 1, 2, or 3 out of 10. And as a professional, we're at a 7, 8, 9, 10. So there's a big gap in what we know. And I think we over plan what we have to tell them, if that makes sense.
Yeah, it does. Because like you're saying, that probably that first experience, if I came to see you, that first experience means a lot, because not only are you probably concerned about what my story is and what narrative I'm telling myself about what's going on, but you're also having to create an experience that makes me want to come back, because at the end of the day, you're running a business.
Yeah, absolutely. It is sales when you present a training program or a treatment plan to somebody. And there's an interesting dynamic with that, because as therapists, we don't want to feel like we're forcing somebody to spend money and we're just in it for the money. And that's why you have to come 2 or 3 times a week, because that sometimes isn't the case, but sometimes it is. And it seems to be, from the therapists I've coached and worked with and mentored and students, that everyone's scared that their clients are going to think they're out for their money as opposed to truly helping them. And there's a disconnect in recognizing your intent and how you say things is what's going to make that come across or not.
Right. Like if you think about your typical client coming in, and welcome, John, thanks for joining us. When you think about your typical client coming in, how do you know, or do you have a framework that you follow? Would an introduction session with me look very similar to how you would run a first session with somebody else? And then how do you know what level of detail to share about yourself or to establish yourself as an expert when you're initially kicking off a relationship with a new client?
It's very person to person in the way that I practice, because it really depends on where the client comes from. If they're coming to me referred from their doctor, or they're coming referred to me from somebody they already trust, I'm already an expert in their mind, because I get that trust by association, versus somebody who's coming randomly off the street and has just Googled where's the closest therapist or coach to me, and they find me that way. In that situation, there tends to be more of a conversation on myself, my values, my beliefs, and my experiences, compared to the referral source, when they already have an understanding of that coming in. So I don't have to necessarily go that deep into it, unless I'm picking up that the client is nervous, which may be the case because they've probably seen other therapists and been told other things. And just so they understand my point of view of where I'm coming from, because I do things different than a lot of other therapists do.
Yeah. So would you say that you deliberately consider the source of where this person is coming
Mhm.
from before you start to work with them, and you're using that to inform essentially how you're going to set up a session?
Absolutely. Absolutely. I think that's a big part of the success that I have, to be honest.
Yeah, and it when I say it out loud, it feels obvious, but I do think it's something that's often overlooked or taken for
Yeah.
granted is you have a lot of information at your disposal before you even ever meet with somebody,
Mhm.
and taking the time to consider, like you said, what's bringing them here? Are they coming through a trusted source? Because if that's the case, I now know that I don't have to essentially establish myself as an expert. We can focus more so on, and you can fill in the blank.
Mhm.
Whereas if I know, like you said, someone is coming to me because I'm the closest by, it might not always be true, but I might now build in a series of questions to gauge what level of detail does this person need in order for me to start to build some credibility. So with
Mhm.
that, the question that I have is how important, I want to ask about credibility, and I want to ask
Yeah.
about what are different ways that you can establish credibility, because I do think it's more than just telling people what your education is. I think there are a lot of
Mhm.
other ways you can establish credibility. And I know I'm putting you on the spot a bit, but what would you say
It's
are
okay.
different strategies you use to create or build credibility with someone who's just starting to work with you?
I think education is often the least or formal education is often the least credible because most clients who come in have no idea what any designations are, what all the letters after our names mean, or anything like that. I've never once had a client bring up the fact that I have a master's degree compared to a lot of athletic therapists don't. They don't even understand what that means. Sometimes they don't even realize that I've actually gone to school for what I do.
Yeah.
And I'm like, no, I actually have a 4-year degree and I'm nationally licensed. Like, that's a thing.
Yeah.
And oftentimes that doesn't even cross their mind. So the credibility comes more into experience, clinical judgment, and how I present myself and the information and how I communicate that. Because if I'm confident and have stories and experiences that match up with the actual science and research, then we can start to put all those pieces together, which is truly evidence-based practice.
Yeah. I like the stories piece. I do, when I work with business professionals on presentations, something we always talk about is the importance of including stories. And most of those stories are personal stories. And I do think
Mhm.
they don't get enough credit. And yet you think about when people take in information and when they remember information, it's always in a narrative format.
Yep.
And as a therapist, people come in, and I think right away there is a distance. There's a distance. I coach. If people come in and physically when they see me, I look athletic, right away I know that I have a barrier in front of me that I need to overcome, because this person is judging me and they're
Mhm.
thinking she looks different than I look. And that, even though that's something I am proud of, I know that it's a barrier for me getting to the place that I want to get to with this person, because it feels like we're not the same.
Mhm.
And to build on what you were saying, I think sometimes if you try and over credential yourself, or you directly tell people or try and prove your knowledge to somebody, even though I think the intention in doing that is, there's a good motivation behind it, what you might be doing is actually creating more distance between you
Yeah.
and this person, because they feel like they can't relate to you, or that you become some type of authority figure to them, where they're going to think twice before sharing really valuable information with them.
Absolutely. And I can say that with 100% experience in the clinic. As soon as I started acting like a real human being instead of trying to be this, I'm an athletic therapist, my name's Megan, this is what we're going to do. And we could have conversations and I could share what my personal experiences and stories are and why I treat the way that I do and what I've learned and how it all comes together. My patients have way more of a connection with me. And it also goes into social media. I used to not share anything personal and I used to talk like a textbook. If you scroll back on my Instagram 2, 3 years, whereas now I talk like a person who's just having a conversation, and people connect and they resonate with it and they understand it better and they're willing to engage with me more and have a conversation. And that conversation is what builds therapeutic alliance, which we need if we want good treatment outcomes.
Yeah. Can you tell me in really simplistic terms what therapeutic alliance means?
Yeah, it means it's the relationship. So therapeutic relationship meaning the healthcare provider or coach and the therapist aligning themselves and being on the same team and coming at things from the same perspective towards the same goal.
Okay. So what would need to be true for someone to say that they have a strong therapeutic alliance? Like, what would you see about that relationship or how people are behaving in that relationship that would allow you to define it like that?
That there's been a specific conversation had about goals, beliefs, and values, risks versus harms, and that both people are coming together to meet each other in the middle, as opposed to the therapist or coach dragging the client to where we think they want to be and or compromising our values and beliefs to meet the client where they're at.
Yeah. How often do you experience a client coming in and if you're wanting to have a conversation with them about their goals or their values, and there was a third word and I'm forgetting it, beliefs. Thank you.
Beliefs.
I know from coaching fitness, a lot of times initially when you ask those types of questions, they either give you what they think you want to hear or they don't say anything and they almost wait for you to make a suggestion as to what they should think they want or where they think they should be. I'm curious, has that been your experience? And if so, if I were your client and I wasn't doing a good job of articulating genuinely what I wanted to get out of this, do you have any strategies that you use to overcome that? Or is this just a matter of time and a relationship developing?
It is time and the relationship, and also just giving the client space to think. People often think they need to come up with an answer right away, and people are very uncomfortable with silence. And I'm a great example of that too, with all the likes and ums that I used to word just because I couldn't handle 5 seconds of silence in a sentence. Whereas now that space gives them time to think and actually understand what you're asking. And if they give a superficial answer or something that doesn't seem to be really connecting, then it's simply just asking them why or because. And I'll choose each language differently depending on how I see that client reacting, because sometimes asking why can feel interrogative.
Yeah.
Is that the word I'm looking for?
Like you're a detective.
Yeah,
You're questioning
exactly.
their motives.
You're questioning it, and they can seem a little like, oh, what do you mean? Why did I answer that wrong? Versus what I learned from one of my other coaches is using the phrase because, and then that just gives them the space to keep talking.
So you're saying,
and then I sit there and wait.
Okay. Yeah. And you don't interrupt them and you process what they're saying to know if there's deeper that you can go with that. And an experience I had once is I love to ask questions, and I'm someone who I want to get past small talk as quickly as possible so that I can know you as a human being. And that's played out, I would say, mostly well for me in a coaching setting, especially in fitness. But there are certainly times when I do think you can get into a place where you ask too many questions and that person begins to think, okay, I feel like I'm being interrogated. I just want you to treat me. And so I'm curious to know how do you balance knowing what questions to ask or how many to ask and not necessarily risk them not coming back because it felt like you were harping them?
A big part of that was learning and understanding nonverbal communication skills to be able to read that in the client and just being able to recognize, okay, I'm starting to push this person a little bit too far. The strategy that I use is giving them the space to answer the question. Once they're done their train of thought, I wait a couple extra seconds and just make sure that there's nothing else that they want to say. And you can usually tell if someone's like thinking about it and like about to say something else, and then they pull away. And then I'll just simply ask, is there anything else that you feel I need to know to best help you today?
Yeah.
And then that puts the ball in their court and gives them the ownership of saying like, yes, I want to choose to tell you more versus no, I think that's good.
I love that question.
Thank you. And from like the coaching or therapist perspective, my goal with every conversation is to make sure that I have the information that I need to be safe and effective.
Mm-hmm.
So as long as I can check those two boxes and say, do I have enough information about this person's medical history, about their training history, about their lifestyle to make informed decisions and to be able to best present them their options? Yes, cool. Then I'm comfortable stopping. And if not, then I straight up will tell them, look, in order for me to make a recommendation, it's important that I understand, because some people will be like, why do you need to know about my whole medical history of diabetes and heart stuff if I have an ankle sprain? And they're like, why is that important? And then that just gives me the space to explain, okay, well, with exercise, XYZ could happen. I need to know if there's any risk factors here. And then people are willing to do it. Most of the time, I think if they're holding back, it's just because there's no trust yet.
Yeah, I agree.
Right.
And I did a presentation a few months ago, and in it, I did some research about what people value when they're receiving bad news from doctors. And what I found most interesting was this conclusion that a lot of times doctors, the questions they end up asking will just be the questions that only give them the information that inform treatment. But something that I took away from your biopsychosocial stuff when we were going through your presentation was that that's important, but to the client, that's maybe the least important is the logistics of why they're there. The narrative of the story about why they're there is so much more important, even though it might not necessarily inform your biological treatment of them. So I'd love to hear you connect how maybe coaches or therapists can begin to appreciate the need to let people tell the story, maybe the emotional or psychological story of why they're working with you, and not writing that off as information that's not valuable.
I love this question. I think to start with, we have to recognize that whether this is training or whether this is therapy, it's always a human being in front of us, not just a physical body. So therefore, biological and biomechanical and biomedical explanations are only going to be one piece of the puzzle. Everybody has a mind, body, soul, right? And what happens in somebody's minds, because their thoughts inform their actions, which inform their beliefs and how they act in the world and how they receive information, is very, very important for you to understand if you want to have two-way communication, right? We can, I'm sure both can agree on that. Mm-hmm. And then there's also the social aspect of things in somebody's environment. What are their lived experiences? What are the people around them in life teaching them? And what are they picking up from that? And if we ignore psychosocial, we're ignoring 2/3, if not more, of the person or the human being in front of us. Mm-hmm. So that's why I think it's so important to create that space and recognize that, yes, psychosocial factors are there and they may not be playing a direct role in that moment, but that could change over the course of treatment. And that's why you have conversations every time you meet with somebody. You don't make assumptions, because one day it might be 1/3, 1/3, 1/3. The next day it might be all psychological. The next day it might be all social because they had a fight with their partner or a bad day at work, that's influencing their current state of fatigue. Or maybe they truly just had a bad sleep because they were sleeping on the couch somewhere or something.
Yeah.
And if we don't ask those questions, we'll never know. And we're just making assumptions. And as a coach and as a therapist, if we make assumptions, we're doing a disservice to our client, in my opinion.
Mm-hmm. What's an example of a question you use, maybe at an initial or in the beginning of a relationship with someone, that would get them to reveal something other than the physical injury or why they're there?
Something along the lines of if they notice their pain or symptoms changing throughout the course of a week, and then people will often start alluding to, oh, it's worse when I'm at work, or it was better when I had a day off, or my back didn't hurt at all when I was in Mexico for 2 weeks. I wonder why that is. It must have been the weather. Maybe it's because you weren't stressed out anymore, right? Then we can start putting together pieces like that. Or I'll ask somebody to walk me through their day. And then from that, I can start to get a sense, are they avoiding certain things? Are they enabling themselves in other ways? Are they having conversations with people that might be influencing what they're feeling?
I love that. And that question of asking them to walk you through their day, that was something that you and I discussed previously. And so I want to
Yeah.
dig into that a bit, because we had a discussion, or I can't remember what question I asked you. It was more along the lines of, whether we're coaching someone or treating somebody,
Mm-hmm.
there are going to be things that are going on in their personal lives that they will be embarrassed, ashamed, or just they don't trust us enough to tell us, even though we either know that something's there that they're not telling us,
Mm-hmm.
or we know that they're minimizing it when we think it's having a greater impact. That question of walk me through your day, you and I talked a little bit about how that in fact gets you to, they give you information to essentially tell you what they're doing and not doing. And you can use
Mm-hmm.
that as a springboard to say, okay, clearly they're dependent on somebody to help them do this task. And even though they're not going to tell me that directly, simply them telling me that in the morning, they used to go on walks and now they no longer takes walks anymore. They, just go from the bed to the chair. That is a part of their story, and it's information for you. Do you want to build on that a little bit about what that simple question of saying, walk me through your day, can inform you as a therapist or a coach?
Yeah, it can inform so much on so many levels, from biopsycho and social, because biologically, we'll figure out how much stress they're actually putting on their body physically if, they go from couch to desk back to couch again, or are they going for walks, or are they doing their own housework, are they doing their own yard work? It gives us so much valuable information into that. Psychologically, we'll start to figure out, are they scared of certain activities? Because that's when clients will start to be like, oh, I used to do this, but I don't do that anymore. Things like that. And then we can start to lead into the, okay, maybe this is a fear avoidant thing now, or they just don't know if it's safe to do something. And then from the social perspective, this is where if somebody's never mentioned, preparing their own meals for the day, I can say, hey, do you do your own cooking? What's it like when you stand at the counter for 20 minutes? And they're like, oh, no, my partner does that for me now. Then I can more easily lead into the, okay, is that because it hurts for you to stand that long? Or are you unable to reach for certain things? Or what is the barrier there? And then because they're the ones who brought it up in the first spot, they're just responding to my question now. Whereas if I came in hot being like, so do you cook your own meals? Does your husband do everything for you? Does your girlfriend take care of the house and you do nothing? Like, people are going to be turned off by that.
Yeah, absolutely. It is such a powerful question. I want to say it again. So the question is to have somebody walk you through their day. What does a typical day look like?
Yeah, it's like with any open-ended question, really. If I want to get information from a client and I set it up so they can just purely say yes or no, they're going to say yes or no. And then I'm going to have to ask more questions. And then there's a chance that they'll feel like they're being interrogated.
Yeah.
Whereas if I ask more of an open-ended question, then that gives them the space to just talk and share their story.
Yeah. And even the wheels are turning, and I'm thinking you could also inquire about, if this was no longer an issue, what would be different about your life now then that it's not right now?
Absolutely. That's a great one.
I just finished reading a book about, actually written for psychiatrists and psychologists. It's about dealing with resistant clients. And I found one piece particularly interesting is that when people come to therapy, typically they focus on what they don't like. I don't like that this is going on. I'm here because I don't like this. I don't like this about my life. I don't like this. And one of the strategies that they lay out in the book is helping that person, instead of talking in terms of what they don't want or they don't like, rephrasing those as things of what they do want and what they do like. Do you do you think that has a place in what you do? Is helping
Absolutely.
people understand how their own words or the way they talk about what's going on impact their experience of pain or just their physical body?
Absolutely. There's so much power to our words. And the thing with people who have experienced pain for a long time, especially, and that's typically what I deal with is clients who've had chronic pain, is they've built that into part of their identity now at this point. Oops, I just lost my headphone.
You're good. You can grab it.
Where did it-
Might as well. It'll be a better experience for you.
yeah, exactly. Um, People start to build that into their identity. And then that's all they know. And that's their whole life now, is their pain and how it's affecting their work. It's affecting their life. It's affecting home life, work life, social life, everything. And if somebody is only ever focusing on that, you're going to see more of that. And that's basic psychology in our reticular activating system. And what you look for, you see more of. Right?
Yeah.
That example of, if I say, don't think about
Yeah.
a pink elephant, you're going to think about a pink elephant. And it's the same thing with pain and limitations. And some of that has to do with, I think, just the clients being so stuck in it and stuck in their stories. And this is what they're experiencing every single day, that's all they're seeing. But some of that does come from us as a therapist and the coaches too, where we often do such a good job telling people how shitty they are and how crappy their movement patterns are and how much is wrong with them. But then that's all they're going to focus on and start to withdraw more from activities, because now they're scared, because one time their therapist said, "Ooh, your knees caved in, that's bad for your hip and your foot, and now you're going to pronate and you're going to have to wear orthotics." When really, okay, their knee caved in. Cool. Let's calm down.
Right.
It's not the end of the world. But then the client takes that on.
I'm assuming that at some point in your career, you've worked with someone who victimizes themselves, or they have that type of victim language. What if, let's say I was that person? What would my experience be like with you if I was that person and you were treating me? What are there things that you would coach me on related to that, or would it just be about the way that you were facilitating treatment?
It is more about the way that I facilitate. The one question that I would ask, and I've only learned this recently, and I was in a victim mindset myself for a long time with my injuries and using it as a coping mechanism to get out of doing things that I didn't want to do. And it comes back down to asking that person, like, do you want something differently? Do you want to change this? Yes or no? If you do, great, cool, I can help you with that. If you don't, that's okay too. But at least now we're on the same page here.
Yeah. And I can't imagine that someone would say, no, I don't want to change. But what might even be interesting too is to ask somebody, what's comfortable about your current situation?
Ooh, I like that.
And get them to identify that being here, you don't have to be here, but clearly you're here because there are certain aspects of what's happening that are encouraging you to stay here, even if when you say those out loud, they don't make a whole lot of sense. And I think if you were to use a question like that, you would want to almost frame it as, when we experience injury or things, there are aspects of our life that change that sometimes make our life don't not feel as hard, and it can feel more comfortable because we have people caring about us. We have people asking and checking in more than they used to. Is there anything about your current situation that you would love to carry over once we do heal, that we get through this or we overcome this issue that you're dealing with?
Yeah, that's a really powerful way to word that. I like that.
Now I just have to find a way how I can use that question too. In coaching.
I'm sure it's going to be easier than you think.
Yeah. Well, I trained somebody, and I know about her life, and there's very little recognition of her in her life. And so having health related issues and pain is a way that connects her to other people. And I can imagine for someone like that, it feels like you might lose your all connections that you have, and that if you heal yourself or if you work with someone to overcome this, I don't want to use the word heal, I don't think that's correct, but if you work with someone to overcome this, you might find yourself in a place where nobody's checking in on you anymore, or people aren't feeling bad for you, and there is a comfort in that, and I think we can all relate to that.
Absolutely. One of the biggest human desires is always connection.
Yeah.
And if this is a way that you get connection, some people will absolutely want to keep that going.
Are there people that you've worked with where they don't make quote unquote progress?
Yes, all the time.
Can you just talk to me about that experience and what that's like from a therapist's perspective, and what challenges you face? Because I think it's the same for coaches too. You work with someone who came in with goals, and then they end up becoming kind of just a, for lack of a better word, chronic client.
Yep.
Can you talk a little bit about that experience?
Yeah, I used to take it personally, and it used to frustrate me so, so much, because I always thought that I was doing something wrong and that I missed something and that I wasn't a good therapist because this person wasn't getting better. And what shifted that for me was going down the road of what Kevin and I talk about a lot is behavior change and accountability, and recognizing that somebody needs to be ready, willing, and able to change if they're going to change any sort of behavior. And they have to understand that a new way of doing things or a new habit is going to serve them better than the old one. And they might just not be at a place where they're ready to accept that. And that might be because somebody else caused their injury. They might be dealing with the fact that they might not be able to go back to their job or their sport because their injury is career ending, and they have to go through that whole grieving process. And no matter how much I can build into an exercise and rehab program, I can't speed up that other process until they're at that position too. And I can recognize that now, whereas 3-4 years ago, I didn't.
Yeah, I could imagine. I would take it personally. Why aren't we progressing? I'm doing everything quote unquote the right way. You're showing up.
Exactly. I'm doing what the textbook said to do.
Yeah. When I'm also imagining that in that scenario, the client might displace some of the lack of progress or blame on you as the therapist or the coach. Do you think that's true? Have you experienced that before? Like how does your communication change when someone is on a plateau, even though the expectation might be that they shouldn't be on a plateau?
Yeah. Usually that will show up as the client thinking that as a therapist, I missed something. And I've been misdiagnosed by the doctor, or I should have had that MRI scan, or someone's missing something, or people just don't understand me. And in that situation, again, 5 years ago, I would have taken that very personally and been like, no, I didn't miss anything. Like, I did my exam and I know what I'm talking about because I know I'm a smart therapist. Whereas now I'll use that as a teaching opportunity, and we'll go through a full assessment again and rule out all the bad, scary things. And if it comes back down to I can't find anything, I'm at a point now where I'm very confident in knowing this is psychosocial versus something biomedical. So I'll either refer them out or ask if they're open to talking to a mental health professional or somebody who specializes in chronic pain more from that side of things, or refer them to a trusted doctor that I have to just be that reassurance, because sometimes I'm just a 30-year-old athletic therapist that people like the doctor's opinion, right?
Yeah. If you notice that someone's not progressing in the way that you would like or expect to, and they're not challenging you to say, Megan, what's going on? I thought I would be further than this by now, which would kick off the conversation you just mentioned of let's
Mhm.
go through an assessment again. Let's rule out anything that you're concerned about and let's continue that conversation. But sometimes clients aren't going to challenge you and say, why aren't I progressing? But it's just not happening. Is that a conversation that you will broach anyway? Or do you always wait for someone to bring it up themselves to notice that there's no progress happening? And I'm assuming it's
No,
dependent, but just generally speaking.
yeah, most of the time I will be the one to start that conversation if I have to, if the client's not doing it. I don't want to leave anything on the table and think that I'm missing something. So I will have the conversation based on, expected healing timelines for this injury are 8 weeks. Like, we know a bone is going to heal in that much time. We know a ligament is going to heal in this much time. If we're not making progress around that, then I believe it's my due diligence to make sure that I have all the information that I need. So I'll approach the conversation more from that perspective as opposed to flipping it on to the client. Like, I just want to double check that I'm doing everything I possibly can for you. So let's reassess this. Let's bring in another person. Let's fill out these questionnaires so I can get a sense of what's going on. Like, walk me through your day. Like, let's figure this out.
Yeah.
And then the client is I've never had a bad experience going through it that way, because sometimes they're just unaware. They don't know if I didn't do a good job communicating at the beginning. Like, I expect this to get better in 12 weeks.
Right. Well, and I do think that's a really interesting point that you made about you bringing it up first, because I do think it's a way that you as the therapist or the coach signal to somebody that my ultimate goal is to help you and be in service of you, and me
Mm-hmm.
choosing not to tell you what I'm observing about what's going on, even though it's different than what we both expected. It's almost like I'm trying to hide something
Mm-hmm.
that I myself believe that I'm not doing something correct. And if I tell you, hey, do you notice this is going on? It almost feels like something I'm embarrassed about, or I don't
Mm-hmm.
want to bring it to their attention because they may think, oh, yeah, I didn't notice that. Now that I think about it, you're not a good coach or you're not a good therapist.
Yeah.
People don't respond like that. I think if a therapist or a coach were to bring up and say, here's what I'm noticing about our time together and what's going on. Have you noticed this going on? That to me is a really easy way for a therapist or a coach to assert themselves and to say, I'm not afraid of being wrong, because my goal far above being right is to help you get better. And
Mm-hmm.
clearly this approach or what's going on or the environment is not letting that happen.
Exactly. And once you broach that subject, one of two things is going to happen. The client is going to acknowledge, like, hey, something's not right, but I'm also not following through with what I said I was going to do. Or they'll be like, no, like, I'm doing everything asked of me and I'm trying my hardest, and I don't know why this is not progressing either. And then it's like, okay, cool, let's move on and try these other options then. Because it could be that the client's not doing something on their end. It could be that I missed something as the therapist, or I could just not be the right therapist for that person either, which is something that some people need to place more weight on.
Yeah.
And that comes back to that therapeutic alliance that we talked about to come full circle.
Yeah. Oh, that is an interesting point to say this. Let me see if I can connect you with someone else who might serve you better. I mean, but
Yeah.
I think that's, even if it's not a formal oath, that's an oath anybody who helps people takes, is if you're
Mm-hmm.
really acting in the best interest of somebody, when you see that you're not serving them in the way that they need to be served, it's your responsibility to find a way to change something or to move them on to somebody else who you do think can help.
Absolutely. I had a client like that just this past week where she is experiencing numbness in her leg, and she firmly believes that it's because her quad muscles are tight, and she's not receptive to a physician's diagnosis or my own that it's coming from her low back. She wants heat on her quad and massage on her quad because that helped her at one other point in her life for a different injury, but she believes it's going to help again. And yeah, I could put the hot pack on her leg and I could massage her leg and do ART and FR and get her stretched out and do things. But as a therapist, I believe it's coming from her back based on the test that I did. If I go into this treatment not believing in what I'm doing, there's not going to be a good outcome because I'm subconsciously or consciously going to be like half-assing the treatment because I know it's not going to work.
Yeah.
And
And they can feel
yeah.
that.
And that's not fair to her. So it's in both of our best interests for me to send her to somebody else, which I did. And I said, look, I don't think I can help you with this based on what you're saying and what I'm finding in my exam. Would you be open to getting another opinion?
Yeah.
No one's really going to ever say no to that.
No, and they usually like you more.
Exactly.
They're like, no, I don't, because I know that no one else is going to say something like this to me. And you seem like a genuine human being.
Right, exactly.
All right. I want to look at this list of questions we had because there are some good questions on here. All right. So we got into this long conversation, but where we started was about how addressing the need for therapists and coaches to take some command of the way they talk to their clients or those that they're treating about what the plan is or what the treatment process is or what to expect. Because an issue that you see going on is a really passive delivery, which absolutely impacts outcomes.
Correct.
So that takes us into the question of when therapists or coaches don't communicate assertively, clearly about what's going on, the expectations, what the relationship is going to be like, what the treatment plan is, I'm assuming there are some unnecessary complications that come as a result of that. What are some of those when it's not communicated assertively or clearly?
What we alluded to already is the lack of trust and the lack of confidence. For sure, that's going to be the biggest thing that comes across. This is where I think people will also fall into the trap of wondering if this is about money and does this therapist just want my money? Do they actually care about what's going on? That therapeutic alliance that we spoke about, that's going to lead to negative outcome effects if there's low therapeutic alliance. Research has shown over and over again that if a client perceives a better relationship with the therapist, there's less pain and disability reported and there's improved function. So we're going to miss out on that. And then it also leads to the issue of compliance or non-compliance, which is one of my favorite things to talk about, because if I haven't communicated a clear plan for somebody and they haven't agreed to that plan, because what I've learned from you is making sure communication is a two-way road.
Yep.
I'm going to start blaming the client and saying they're not following through on things. But did I even tell them what to follow through on? Probably not. So then we go into that whole accountability and buy-in versus buy-out situation.
I have a personal example of this. My mom has been having really bad knee pain recently, and she lives in the Chicago area. I am out in California. And so she had a physical, just an annual physical scheduled. So she was going to ask her doctor. I told her, I said, ask him to write you a script to go to a PT and see if you can have someone work with you. Well, what this doctor did, he looked at her knee. I think he did some like internal, external rotation stuff. And then he said, oh, this is verbatim what she told me. He told me it was a tendon. And then he gave me this 9 pages of these exercises. And he said to come back in 3 weeks. And I said, no, Mom, what did he say exactly? She's like, I just told you what he said. I said, he gave you 9 pages. She showed it to me. And there were repetitive ones in there. There were some for arthritis. There were some for meniscus. And she said, which ones do I do? And immediately I thought of you because that's the problem. That's the problem is to her, she's not going to do them because you can't give someone 9 pages of exercises she does not exercise. Unfortunately, I'm trying to convince her, but she does not. She has no idea what to do. He did not show her how to do the exercises. And yet he's saying, do this. And essentially that puts it on her of if she doesn't do these exercises or she doesn't do them correctly, even though he didn't set her up for success,
Yeah,
the blame's going to be on her that her knee pain isn't going to go away.
absolutely.
And
Yeah.
then probably what's going to happen is he's going to refer her to an orthopedist. They're
Mm-hmm.
probably going to get an MRI, and then they're going to say, oh, we can clean this up. And I'm like, do not go down this hole. So Brendan and I talked her through, and we picked 3 exercises and showed her how to do them. But it's exactly what you're talking about. If you don't tell people explicitly and you're not totally clear and you don't take time to make sure that they get their questions answered, that you create a space where they can say, even though you've explained this to me 3 times, I still don't get it.
Mm.
You failed.
Yeah, absolutely. It's 100% the therapist or the doctor or the coach's fault.
Yeah. And it's just amazing to me though, that there's still this issue of being passive and not,
Yeah.
but it comes back to what you said of there is this innate fear that if I commit too much to something and I say, this is the way we're going to do it, this is what I want you to do, and something doesn't go to plan, we're communicating in a way that's self-protective and not service oriented.
Yeah, that's a great way of explaining that. Yeah.
And yet, of course, there are also obviously legal implications that you do have to be aware of. So I'm curious, can you talk us through when you feel like you're in a place where you can either communicate a treatment plan or you're communicating with a client about what you need them to do on their own? How do you approach conversations like that? How do you assert yourself? How do you also, though, think about protecting yourself? Because I'm assuming that is a thought. It has to be.
It is. It always is a little bit of a thought. I will say, being in Canada, I think there's a little bit less of
Yes,
a
got it. Yes.
thought on that sometimes, because we don't get sued the same
Yes.
way.
Yes.
But jokes aside, I think the most simple way to have that conversation is to less is more sometimes at the beginning of that conversation, by just sitting down with the client and saying, look, this is what my findings have shown. This is where you're at. This is where you've told me you want to be. And then pause and clarify and make sure you got that right. And we completely understood their goals. And then I can say the best way that I know, based on current research, my experience, what I've seen before, to get you from where you are to where you want to be is X, Y, Z. I know from science, or however you want to word it, that it's going to take at least 3 months to build some strength, for example, or it's going to take 12 weeks for a ligament to heal, or the training effects that happen within 4 to 6 weeks. Whatever that goal is, I can specify that and then say, so I think based on that, us meeting twice a week for 6 weeks is a great starting point. And then at that point, we'll reassess and make sure we're on track. And then we can either increase or decrease from there. And if I tell that client, great, like if I tell you, like, I'm not going to loop you into 3 months right off the bat, but like, obviously we're going to check in every session and make sure things are on track, but we're going to formally reevaluate everything in 6 weeks.
Yeah, that it is clear. So and even if we pull all that up to a broader level where it's not detailed, what you're doing is you're first saying objectively, here is what my assessment has revealed.
Yeah.
Okay, so objectively, then you're clarifying goals. Okay, so right away, what you've done is you've identified a gap, and they see that gap as well, of like, okay, there is work that needs to be done because this is an objective assessment and here's where I want to be. And now right away, that's the first, I think, moment where they're probably buying in and saying, okay, like, I get it. There's nothing for me to disagree with here. Here's where I am. Here's where I want to be. They're not in the same place. Then you're essentially saying, now, there's probably a lot of ways we can go about this, but from my experience, and you're talking from a personal perspective of your experience, what tools you can comfortably use, and what you've learned about this person, here's a recommended path. Now, I want you to talk a little bit about, I'm assuming that's I think a place where coaches or therapists probably hesitate, is saying, here's the recommended path. That doesn't mean you commit to that path and you're going to die on that path.
Exactly.
So how do you set the expectation for a client to say, here's what I recommend we do? And I think you did answer this already. we're going to go on that path. And when you brought up the point about reassessing, that's the reassessing comment. Is that your way of essentially telling them that we're going to do this as long as it's working the way we want it to work, but there might also be a time when we're going to change directions?
Yeah, exactly. Most of the time that implication is enough for people, and they seem to get that. Sometimes I will take it a little bit specifically deeper and say this might not go according to the textbook because of XYZ reasons that you listed, or you might just progress faster, or you might progress slower because everybody's different.
Yeah.
But on average, it's going to take, we're going to spend 3 weeks on this block, and then you're going to get good at these exercises, and then we'll be ready for a progression. Yeah. However, if it takes a little bit longer, cool, we'll bump it a little bit. If you're ready sooner, we'll progress sooner.
Yeah.
And as long as clients hear that, then they realize that this is a dynamic situation.
Yeah. Well, and you're not the way you're wording it, you're not putting yourself in a position where if it doesn't go to plan, it looks like you didn't do your job.
Mm-hmm. Exactly. And from a legal perspective, even if it's because I'm working with insurance companies or things like that, because I'll see clients on claims for long-term, short-term disability, and they want a treatment plan laid out. And I have to say, I'm going to see them, once a week for 4 weeks, and then once every 2 weeks. And I expect this to be better in 10 weeks. Even that, even though I'm writing on a medical legal document and signing my name to it, like that's not set in stone. As long as you recognize sooner rather than later if something is not going according to plan, and you bring it up so before it becomes a problem and you're tackling it head on, then everything will work out. People will respect the fact that you're like, hey, my plan's not going according to plan.
Yeah. Yeah.
I love that. Reactive.
I think it's a really, you kind of laid out a little framework. It's because even coaches do assessments. Here are the findings. Here's where you've told me you want to be. Clearly there's a gap. Here's what I think the best way to close that gap is, at least initially. We will reassess because bodies are different. They respond differently. That things can change. But right now, like this week or today or tomorrow, here's what you can tackle explicitly. Mm-hmm. And we will take this one day at a time. I mean, that's the framework. And it's great because you're coming across clearly, you're coming across assertively, and yet you're still leaving room for them to know that this is not a paved path.
Yeah. And I see it as the exact same as at a micro level within session, where I know coaches and therapists do a very good job of adapting within a session. If something is not going according to plan, like their squat just looks like crap today and they're not feeling it, a coach is good at adapting to do that. So why can't we do that in the big picture? It's the exact same concept.
Yeah.
Right. And
yeah, it is.
But there's a disconnect for the coach and the therapist to see that. Whereas, if someone's coming into a session like, oh, I slept really bad last night, my kids were up all night, I didn't eat breakfast today, you're going to have to adapt the training session.
And that's not a reflection on you.
Exactly. So if you're comfortable enough to have that conversation and tell the client, like, look, we're going to do things differently today, no one's going to think that you are scamming them or doing a bad job. They're going to be really happy that you modified to what they need. It's the same with a big treatment plan or training program. They're going to be happy that you're modifying and adjusting to what they need.
Yeah. And you can even bring them into the conversation. I think about if my client comes and I'm going to train her and she tells me the things that you listed of I didn't sleep well, I ate donuts for breakfast, I'm not feeling great, there's a lot of stress at work. I could even say to her, all right, like, thanks for sharing that. How do you think that that's going to impact what we're doing today? Now, if there's been a cadence established of how we work together and what we're doing, she will have the information she needs to at least say, yeah, I think if we're going to do the typical Tuesday setup that we normally do, I'm not feeling up for doing bike sprints or whatever it might be. But now it becomes more of that collaboration of saying, hey, you know how we work together. You know how your body is feeling. Let's adjust, and not just me calling the shots. Although, of course, there are absolutely times when you do need to.
Yeah, absolutely. And it's interesting to see though how comfortable coaches are in that specific situation.
Yeah.
Like no one thinks twice, and they're great at communicating why we're making a deviation on a plan. So let's just take that exact same skill and plop it onto a training program as a whole.
Yeah. So you have this mindset. Like this is when you think of yourself in your role as a therapist, you have an idea of you, who you are, and who you want to be for your clients. I'm curious. What's the difference between your mindset, like your personal mindset with this approach that you've been walking us through for an hour versus a coach who's more like self-protective, or they're passive in the way that they interact with people? Like, how do you view yourself in your role versus a therapist who maybe is a really passive communicator or really directive in the way that they communicate? And I can try and ask this another way if it's confusing.
Yeah, please.
Okay. So like what's coming to my head is when you, based on what I know about you and what you've shared today, to me, when I think about the way you approach your work, it feels very service oriented. It feels like every decision you're making is in an effort to get to this end goal. Okay. And that you're making decisions not for your own self-interest, but in the service of helping this person in the way that you think you're supposed to help. Now, those inform your decisions.
Right.
If I went and met with a therapist or a coach who didn't have that same mindset, that's reflective in the way that they communicate. And I think that's what we're talking about, are the coaches and therapists who maybe are focused first on themselves and what they think they're supposed to be and sticking with what they know and the prescription and those sorts of things. But when you act in service of yourself and you try to protect your own image or your idea of the type of therapist or coach you are, typically you end up as a disservice.
Correct. Yeah.
To the people that you work with. And that was a really long monologue, and I wanted it to be a question, but if you want to add anything, please do.
No, then I have some clarity now. That thank you. The reason that I have gone that way in my practice is because I've been on the receiving end of both styles of treatment. I've been that client who has had pain that was unexplainable according to the MRIs and all of that. And I had surgery and should have been better, and I wasn't. And I experienced both types of therapists, some who were just like, well, come in twice a week and we're going to do the same thing. And I'm going to have your rehab program written on the whiteboard before you even show up for the day. And sometimes I didn't even get to talk to the therapist. I was just expected to start that and maybe meet with them later. And then I found the therapist who talked to me as a person and got to know me, got to know my story, and started to poke the bear of my nervousness and anxiety and dealing with grieving my injury and all of that. And I know the difference in how I felt being in both of those situations. And I never want anyone to feel what I felt with that first therapist.
Yeah, I have goosebumps. I mean, it's so true, because like you mentioned earlier that you're working with a human being. There is nothing quite like feeling seen by somebody. And if it really is, I think coaches and therapists have an incredible opportunity to both be the person that sees the other person and then offer them help.
Yeah, exactly. It's a person, not a number. And as a therapist, as a coach, it's so easy to get caught up in that, you're my 8th client of the day. You're, the hip injury or the sore back or rotator cuff strain. And there's something to be said about not getting emotionally attached and involved in trauma bonding with your clients and whatnot, but you still have to see them as a person. And remember that, yeah, these injuries as a therapist, it's every day for me. It's normal, but this is a big thing in this person's life.
Mm-hmm.
And so going into every single conversation, recognizing that like they're a small part of my day, but I'm a big part of their day.
Oh, put that on a t-shirt, Megan. That's great. I really like that. I mean, it's so simple, but it's
yeah,
really, that's a powerful way to look at it. They're
that's
a
how
small part of my day and a big part of their day. I love that. I really like that.
yeah, that's how I guide all my decisions and why I practice the way I practice.
Yeah. Yeah. I mean, it is I mean, it's exhausting to put that type of energy into somebody. But what's fascinating is even though the output of that energy feels exhausting, your cup is overfilled by how people respond to you, just in the way that you see them light up, you see them feel cared about. And although it's all intangible, it feels really good, and it feels good to be in a position that you can provide that to somebody. And it should be something, I think, that motivates coaches and therapists to show up every day and to say, I'm in a position where I can help this person feel seen, and I can provide something to them that no one else in their life at this moment can do.
Yeah.
Oh, Megan, are there other things you want to talk about or questions? And I do want, before we close, for you to tell us a little bit about your research for us to close. But is there anything else you wanted to say about the passiveness of communicating treatment plans, which we covered a bit, and then about questioning?
I think I'll end it with recognizing, again, as a coach, as a therapist, that this is going to be a learning curve for us. And anybody who's good at communication and communicating these things started with it being a struggle as well. And that's why it's so important to get the reps in and learn these types of skills, as well as our therapy and coaching skills, and take the time to practice having these conversations. And something that I sticks out to me from one of the first times I saw your social media, I think, there might have been something you said, but it was that every time you talk to a client, it's public speaking.
Yeah.
And then just recognizing that, like, oh, I'm in this position, this is public speaking, I need to put some effort into this. That's what's going to help and make the biggest difference.
Good. Hopefully that's contagious, Megan.
I hope so.
Yeah, you're right. I mean, every single day we are either perfecting ineffective communication strategies that are maybe even, acting in hindrance of what we want for our clients or the athletes that we train, and realizing that am I perfecting things that are ineffective, or am I going to take these reps and move in the direction of something that I think will be more helpful for me in my career, but also for the people I work with?
Exactly. Like, there's been such a change in how I communicate just in the past year of working with you. Never mind even just in the past few months.
Megan, you're incredible. That I appreciate that compliment.
Thank you.
I really take that so seriously, and thank you. But also, you've put in so much work, and you practice and you think about it, you reflect on things, and there's a lot there. Even those simple steps most people don't do.
Exactly.
Okay, so to wrap up, Megan, I want you to tell everybody I'm going to watch your presentation this weekend, but you recorded your presentation, you did some research. Can you just tell us what you did research on, and if anyone's interested in engaging with you about it, how they can do that?
Yeah, so I went back and did a master's a couple years ago because of this disconnect between people's pain and their biological healing and symptoms, and wanting to better understand and recognize why some people didn't get better, which is how, again, now I've learned how to frame everything that I do. And I wrote a paper published in the Journal of Athletic Training this past year, called Managing Persistent Musculoskeletal Pain Through a Biopsychosocial Lens, which I turned into a presentation and webinar that acknowledges that pain is not always coming from something physical and biological, and how to, it's written to athletic therapists, but the principles can apply to any healthcare provider, any coach. It's published in an athletic training journal, so you have to throw those names in there once in a while to get published. So, and it's all about having that recognition and then giving yourself tools and how to recognize this, how to assess differently, how to rehab differently, and what it comes down to is it's not the different exercises in the textbook, it's not the different assessment strategies, it's communication, and it's how we frame things as a therapist that's going to influence the client and all of our treatment methods and approaches. So I'm really excited to share that. And if anyone wants that, they can connect with me through Instagram at Megan Pomarensky or empowermentrehab.com.
Very cool. And I will include those links when I post this on YouTube and then in the caption too of the post. Megan, you're a great friend, and I'm just honored to know you. You're doing really good work, and I appreciate you taking the time to make us all better today.
Thank you so much. I can say the same for you.
Thanks, Megan.